Hi, my name is Christian Stover, and the topic of my presentation is contraception, which is also known as birth control. And the group that I am focusing on is college students. What is birth control? Birth control is any method to prevent pregnancy, and it can be used to treat irregular periods, cramps, and acne. It allows people to put off having children until their bodies are fully able to support pregnancy. Helps reduce the need for abortion by preventing unwanted pregnancies. Birth control among college students. The topic of birth control is important for college students because 80% of college females are sexually active and most are not seeking to become pregnant due to the fact that they are still in school. Nearly 40% of college females are on the pill. With many choices of birth control, 3 in 5 choose the pill. 30% of college students use the withdrawal method as a form of birth control. Birth control through school. Some people wonder if they are able to get birth control while at school. If you have health insurance through your college or university, you may be able to get birth control. Student health centers will have birth control, and doctors will ask if you want birth control if you go there to get regular checkups. The history of birth control. In 1873, the Comstock Act passed in the U.S. prohibited advertisement, information, or distribution of birth control. In 1916, Margaret Sanger opened the first birth control clinic in the U.S. and was sentenced to 30 years in prison. In 1938, a judge lifted the ban of birth control. The history of birth control continued. In 1960, the first oral contraceptive was approved by the U.S. Food and Drug Administration, which was in void. In 1968, the FDA approved IUDs. In 1990, the first contraceptive implants were introduced. The different types of birth control. Birth control pills, condoms, vaginal rings, Depo-Provera, intrauterine device, birth control patch. The, the different types of birth control that are available have been used by 62% of women who are in the reproductive age that are currently using contraception. Birth control pills. It works by stopping sperm from joining an egg, which is called fertilization. 91% effective, prescription required, and take once a day. Condoms. 98% effective at preventing pregnancy. It is great at preventing both pregnancy and STDs. In order for it to work, it has to be used correctly and worn every time you have sex. Vaginal ring, which could also be called NuvaRing, is a small, flexible ring that prevents pregnancy by releasing hormones within the body. NuvaRing is 99% effective. About 9 out of 200 ring users get pregnant each year. It won't protect from STDs, work if you change on time. It costs up to $200. Depo-Provera, which is called the birth control shot, an injection you get once every 3 months, safe, convenient, and private birth control method that works if you always get it on time. Costs up to $150. Intrauterine device uses copper IUDs and hormonal IUDs that prevents pregnancy by changing the way sperm cells move so they can get to an egg. Can last up to 12 years, 99% effective. Different types of IUDs are Marina, which lasted 7 years, Kalina, which lasts 5 years, Skyla, which lasts 3 years, Paragard, which lasts 12 years, and Lilina, that lasts 7 years, and can cost up to $1,300. Birth control patch is a transdermal contraceptive patch that is placed on your belly, upper arm, butt, or back, and your skin absorbs the hormones into your body. 91% effective, should be changed at least once a week, can cost up to $150. Emergency contraceptive, which is a Plan B, was created in 1997 and approved in 1999. At the time, Plan B was 2 tablets. The first was taken within 72 hours of unprotected sex, and another was taken 12 hours later. In 2013, it was removed from behind the counters and available to people without a prescription. Can birth control cause UTI? A UTI is an infection in part of the urinary system, such as the kidney, bladder, or the urethra. Some believe that women who take birth control have more sex, and this could cause them to develop UTIs. Sex in general can cause UTIs because sexual activity can move bacteria into the urinary tract. Is birth control bad for you? Using the pills can increase the risk of health problems. Complications are rare but can be very serious, such as heart attacks, strokes, blood clots, and liver tumors. American Cancer Society says that pills can make you develop breast cancer. Common side effects of birth control pills: spotting, weight gain, breast swelling or tenderness, mood swings, and nausea. Some serious side effects are blurred vision, severe stomach pain, severe headaches, chest pain, and swelling or pain in the legs. Birth control for men can be condoms and vasectomy. Vasectomy is a minor surgical procedure that stops sperm from being ejaculated during sex. It is usually permanent. How do you know which birth control is right for you? Contraceptive counseling, health history, past experience with birth control. All of these ways are some ways you can figure out which birth control is best for you. Positive impacts on women's life by using birth control. Birth control empowers women to take control of their lives and allow them to plan for their careers and family growth. Allow them to choose contraception and plan fertility independently with their partners or spouse. Advance women's educational opportunities. Remove barriers to contraception. Saves money to women.